Some folks are a little anxious about using Suboxone, medication-assisted treatment, or buprenorphine. Those are two different names for the same drug.
These medicines oftentimes are stigmatized by community and even unfortunately by healthcare providers. It's gotten a lot better than it used to be 20 years ago. What people need to understand is that now it is undisputable that the gold standard for people with opioid use disorder is medications. And we know over time, demonstrated with study after study after study, is that actually people who are on these medicines live longer and their quality of life is much more improved significantly than those who are not offered these medications.
The anxiety of patients is mostly about this medication is that they're going to get pushed into withdrawal or feel very unwell, which they don't. The other anxiety is, am I just substituting one or the other? How long am I going to be on this medication? Am I just going to be stuck on this medication? Some folks transition and use Suboxone for a period of time and then move on. Other people go years and years and years with a completely great life on Suboxone, just pretty much the way a diabetic who uses just the right amount of insulin has a completely normal life and no complications from their disease. That's the key, is if a patient says, I'm worried about going into withdrawal, we as providers can talk about what the risks are and how to manage that. The biggest thing is to just express the concern and it can be addressed. You know, it's a rare case when there is no solution or viable path. It's just more a question of being like, hey, there's a ladder over there. Maybe you were looking for all doors and what you need is a ladder.
They absolutely work, and they need to be provided to anybody who has an opioid use disorder at their moment of need. And we know that they are much more likely to stay alive if they are afforded the opportunity to stay on these medicines.